Live from WDEF. News 12 this morning starts now.
March is Varicose Vein Awareness Month. We have more information on that. Plus, we're going to introduce you to Dr. Griffin Coates. More coming up next.
Good morning. It's Varicose Vein Awareness Month, and joining us to talk about treatments for varicose veins is Dr. Griffin Coates. Dr. Coates, thanks for joining us.
Thank you for having me.
First of all, tell us what varicose veins are and why we get them.
Varicose veins are the large, bulgy, ropey veins that you can see or feel right underneath the skin. And we get them because the veins enlarge, and then the valves that are inside the veins don't work properly. So gravity just pulls the blood down toward the floor.
Is it dangerous?
It sometimes can be, because it sometimes can lead to larger problems such as ulcers in the legs.
A lot of us hear the reason that we get varicose veins is because we wear high heel shoes. Is that the case?
Well, high heel shoes interfere with the normal pumping action of the legs and getting the blood back up. It's not necessarily a cause, but it's not the best thing for you.
Also, men can get varicose veins. A lot of people don't realize that.
That's true. And part of that's because a lot of men just don't go and seek treatment for it until their spouse may encourage them to, or until the symptoms get very severe.
Because this can be a health factor, it is covered by insurance.
The treatment for it, the evaluation and the treatment for it is generally covered by most insurance plans.
So we don't have to put this off as something we're suffering for. We can get it covered and also get some relief.
That's true. And a lot of people don't realize how many symptoms they might be having because it's been such a chronic, indolent process that they may go on for years without realizing that their legs may be feeling heavy or swollen until someone clinical actually evaluates them.
Let's talk about one of the treatments that you do in the office, which you say is virtually pain-free.
The major problem with, or the major pain with it, is just the needle sticks to deaden the area, but it's not done under general anesthesia. You don't have to be put to sleep. You don't have to have a spinal anesthetic. It can be done with just total local anesthesia. People walk out after an hour and a half or so and can go back to work the next day.
And you've actually had this done, so you know firsthand what it feels like as well as actually being the doctor that performs it.
That's true. And it was amazing to me. I was able to go back to work in the hospital 12 hours after having it done and did a 4-hour surgery the very next day without any difficulty.
And you said you actually felt the difference in your legs once you had the varicose veins removed.
Within 3 or 4 days, I could feel like I had taken 5 or 10 pounds of ankle weights off my legs. And I thought that that my tiredness that had been going on was just because I was getting older and getting out of shape, but it turned out that treating the varicose veins actually did significantly help my my symptoms. What
are some of the reasons, like you said, that folks can get varicose veins? Because some of it we can't even avoid, right?
That's true. Genetics is the big thing. Unfortunately, my mother had bad varicose veins, and I attribute mine to her.
She gave you that as well as other stuff, right?
But this is one of the few diseases that women can attribute to their children because multiple pregnancies contribute to it. Standing professions, surgeons, cameramen, factory workers can be more likely to have it.
Is it associated with weight in any way?
The more obese you are, the more likely you are to have it, but a lot of thin people also have it. So it's not necessarily directly associated. But
well, thanks for giving us all this information on varicose veins. Remember, it is covered by insurance. If you're suffering, you need to give Dr. Griffin Coates a call. He's at 6031 Shallowford Road, Suite 113. The number to call is 648-4181, or go to choochoovein.com. And of course, all this information we'll have it at WDEF.com for you, so you can jot it down that way as well. Thanks for joining us.
Thank you very much again, Rachel.
Appreciate it. Stay with us. We'll take a short break. You're watching WDEF News 12 this morning. Again, all the information on varicose veins and how you can reach Dr. Griffin Coates online at WDEF.com.